Hi, I'm Dr. Jeff Sparks. I'm the ear, nose, and throat doctor here at McDonough District Hospital. I've been here for approximately 4.5 years. I came here from Kirksville, Missouri, which is a very similar town in size to Macomb. When I graduated from residency, my wife and I were looking for a small town so that we could basically feel comfortable and safe, and we were looking for a place the size of Macomb. We basically branched out from Missouri and started looking at places that needed a full-time ear, nose, and throat physician, and that's when we found Macomb, and actually started talking to Macomb when I was still a resident, and ever since the first trip here, everyone was very welcoming, and we really liked it. We brought our newborn daughter at the time with us when we were being recruited here, and everybody was just very caring and very nice, and so we ended up deciding that we were going to come here. I went to medical school at Kirksville College of Osteopathic Medicine in Kirksville, Missouri. Undergrad, I started out at the University of Missouri, and my wife, who I started dating in high school, went to Truman State University in Kirksville, and somehow I ended up going back to Truman State when she went there. So I'm the ear, nose, and throat surgeon here at McDonough District, and so I went through residency, which is 5 years after medical school, and just ear, nose, and throat. The medical name for it is otolaryngology, and so treat everything basically above the collarbone, outside of the spine and the brain. So we, most people know us as ear, nose, and throat, and we treat tonsils and put in ear tubes in kids, and that's what most people think of, but we also treat thyroids and anything to do with the vocal cords and the parotid glands, salivary glands, and a whole host of other diseases. I really like the fact that I get to treat a full age range of patients, so anyone from newborn all the way up to my oldest patient was 105 years old, and so I get to see the full age range, and when we can successfully treat someone that has been ill for a long time and just see the smile on their face when we're done. I think working at MDH is special because of the community that we are in. Not only in the outside community, but also inside the hospital. It is a very tight-knit group that is always trying to find the best way to help each patient. It's not about ourselves, it's about the patient and trying to treat them and whatever we can do to help each other to treat the patient. I spend time with my family. I have 2 young children. My daughter is 7 and my son is 4, and so spending time with them, running around. We like the outdoors, so playing in the yard, anything we can do with them, and then I also like deer hunting. As far as work-related philosophy, it would be to treat everyone as if they're family. So how would I treat my mother? And trying to make sure that I treat everyone with respect and also try to do what's best for them. And so that is how I try to treat every patient that comes in, regardless of why they're here, try to do what's best for them. Outside of work, my philosophy is strongly Christian-based, and so trying to put everyone else first and yourself second.